clinical trial with recombinant human erythropoietin. So first, for all of you who are not so familiar with the drug erythropoietin, what is erythropoietin? It's a cytokine, it's a small glycoprotein, and the molecular weight is about 30 kilodalton, and it consists of 165 amino acids and about 30% of mass are carbohydrates. So
no micro.
No micro. No?
No?
Yes.
Yes.
It's mainly produced in the kidneys, and in the fetus it's also produced in the liver. And originally it was identified to regulate the erythropoiesis. It promotes erythroid differentiation and initiates hemoglobin synthesis. Recombinant human erythropoietin is now produced for more than 20 years, and its main approved indications are treatment of anemia due to EPO deficiency in patients with kidney diseases, in end-stage renal disease patients, diabetes patients, then in patients with anemia of cancer, with multiple myeloma, and also for autologous blood donation programs. And it's also in the newspapers due to the illegal use for sport doping to increase the red cell mass. But EPO has also another side. So there are EPO receptors on many different cell types, and among them there are also cardiac myocytes and neuronal tissues. EPO is a tissue protective cytokine. It was recognized several years ago, and it was shown to be cardioprotective and neuroprotective. Therefore, EPO is useful for the treatment of neurodegenerative diseases and also for heart diseases. And I will show you that it may also be useful for the treatment of euro-ATAXIA. So there are several compounds identified in studies which can increase frataxin expression and which also can promote transcription to GAA. And one of these drugs was recognized by Blum et al. In our laboratory is erythropoietin. Interestingly, it was also shown that free nitropropionic acid can increase frataxin expression, and there's recently a paper which shows that nitropropionic acid can also increase erythropoietin expression. So maybe there is also a connection. Recently we published that frataxin expression is increased in P19 neuronal cells, which increase frataxin expression following EPO at different concentrations. It is a time and concentration dependent increase in frataxin levels in this neuronal cell type. And we also looked for frataxin expression in patient cells, in euro-ATAXIA patient cells, in primary lymphocytes, incubated the cells with erythropoietin at different concentration, and we also found an increase in frataxin expression. So with this data, preclinical data, we went directly to the clinical study, and here is the study design. So it was designed as a single-site, open-label study. It's a phase A proof of concept study phase, where the patients received 5,000 units of EPO 3 times a week, subcutaneously for 8 weeks. And the primary outcome measure of this proof of concept study was a stable increase in frataxin in euro-ATAXIA patients over 8 weeks. And if there are positive findings, we go to B, to the second study phase, also a single-site open-label extension phase, phase 2B, for another 6 months. And the primary outcome measure was improvement in clinical rating scales such as SARA and FAST. So here again the study design, so phase A, treatment for 8 weeks with 5,000 units. The number of patients which were included in this study were 12 patients. After this washout phase, because we had to analyze the samples for frataxin expression, and then we started with the phase 2B with 8 patients for 6 months with 2,000 units EPO 3 times per week. So the patients of phase A were 12 patients. In the first week we had 1 dropout because of the EPO has to be used as injection. So these patients had fear from injections, so 11 patients completed the study. In phase 2B, from phase 2A, 8 patients were included in the study. During this time there was no dropout and no dose reduction, and all patients completed the study. The study population of the phase 2A study was shown in this cartoon here. So, and now to the results of this study. The baseline frataxin levels in the patients, here the individual increases in frataxin are shown in this graph. So the frataxin increase varied from 15 to 63% compared to the baseline, so before treatment. And 2 patients, 1 female and 1 male patients, they didn't show an increase during the 8 weeks treatment, and 1 patient, the increase was not significant. But we found that when we look on all patients, there was a significant increase over the 8 weeks, and there was also a further increase after 2 weeks compared to 8 weeks in frataxin expression. We also looked on oxidative stress markers, and we found that in patients which had an increased oxidative stress, there was a significant reduction in the levels of 8-hydroxydesoxyguanosine, which is the gold standard for measuring oxidative stress inside cells generated by chromosomal and mitochondrial DNA damage. During the 2A phase, we looked also on the SARA, the neurological outcome. However, a major neurological improvement was not suspected after 8 weeks with EPO.